Hello everyone, welcome to today's session. And we have a very special guest on our session today, who is Dr. Swaroop Solunke. Dr. Swaroop Solunke is an orthopedic surgeon. He is a consultant, joint replacement, arthroscopy, and trauma surgeon. So welcome on the show, Doctor.
Yeah. Hi. Hello, everyone.
Yes.
Hi, Omkar.
Yes. I would just like to add some more things to his introduction. Dr. Swaroop has done various fellowships in joint replacements and arthroscopy, and he has done it from Bombay in India. He has done it from Germany, Italy, and the USA. And currently, he is the director of Swaroops Ortho and Polyclinic. It is situated in WAKAD, which is in Pune. And he is attached with very prestigious hospitals like Jupiter and Hardigar. So, doctor, could you please tell us a little more about your experience in this field?
Yeah. So I've done my joint replacement fellowships from Bombay, Germany, Italy, and USA. Recently, I've done my fellowship in robotic joint replacement.
Okay.
So more so, I'm dealing with all kind of orthopedic trauma, any ligament injury cases, as well as joint replacement cases, which most commonly seen. Yeah. So most commonly seen are the knee replacement and hip replacement cases. So knee problems are a lot in India as compared to the European countries.
Okay.
Yeah.
Okay.
So according to the recent condition now, regarding the coronavirus, it has affected very badly all over the world.
Yes. In fact, I was going to ask you how you are coping up with the current situation and how your patients are coping up with the current coronavirus situation.
Yeah. So the current situation is very bad all over the world, as we know. We are coming through with all the news and around. It is declared as a medical emergency all over the world. Even the developed countries like UK, US, Italy have hit very badly with this.
Yeah.
So in India, we are dealing with orthopedic problems recently. Because of this situation, the OPDs patients are very much scared around. We are taking teleconsultations for this kind of any basic problems which our patients face, like back pain, neck pain, and all those things.
Yes.
Yeah. But we are attending emergencies like any orthopedic traumas are there. Any planned surgeries like ligament injury and replacement surgeries, we have kept it at a hold as dictated by the government.
Okay.
Yeah. So we are doing all these things right now.
So there is a differentiation between emergency cases and non-emergency cases, and all the non-emergency cases have been put on hold currently.
Yes. So only any kind of fracture or any life-saving or limb-saving injuries are treated as an emergency nowadays.
Okay. But must be a very difficult time even for all the patients out there and even for you.
Yeah. It is very difficult for the patients as well because some people are quite having problems related to back which are acute, and because of this situation they are not able to attend any hospitals or clinics. It has become very difficult for them. So we are attending them on phone and we are guiding them properly.
Okay. That's great. Yeah. Also, doctor, I mean, me being a nutrition and exercise consultant, when we do the basic screening, the first step is basic screening, then many people or many members of us have something called as arthritis. They have joint pain, bone pain. So, could you please explain us more on that?
Yeah. So, arthritis, when we come to this term, we more so say it is a joint pain. It can be a single joint pain or a multiple joint pain. So there are various types of arthritis. So some are inflammatory types, some are degenerative types. So it happens more so in any kind of joint. It can happen in any joint. Sometimes when there is a multiple joint involvement, it can be differentiated. There are various types of arthritis, as we know. The most common are the osteoarthritis and rheumatoid arthritis.
Yes.
And the uncommon types are the psoriatic arthritis, which are related to the skin problems, ankylosing spondylitis, septic arthritis, gouty arthritis that is related to the uric acid problems.
Okay.
So, yeah, the most common symptoms that are seen in an arthritic patient is joint pain, which can be a single joint or multiple joint involvement.
Correct.
Then stiffness of the joint.
Yes.
Then the patient complains of early morning stiffness, which is most common, which gets relieved after some time when patient starts doing his routine activities.
Correct.
There is swelling around the joint.
Yes.
So these are the various most common problems or complaints which the patient tell us, which are patients suffering from arthritis. Osteoarthritis is most common. That happens because of the degeneration of the cartilage that is present around any joint. So osteoarthritis most commonly happens in the weight-bearing joints. So we know that knee is the major weight-bearing joint as well as the hip.
Yes.
But knee is a different kind of joint, so knee is more so affected as compared to the hip. An Indian population, because of the osteoporosis, is another factor. So that leads to more of degeneration. Our lifestyle has also its factors that is leading to this degeneration. Sedentary lifestyle, no exercise. Yeah. So
and even I think obesity is also a risk factor.
Yeah, obesity is also a risk factor. Most commonly, post-menopausal women, where there is osteoporosis as well as osteoarthritis is a major problem. Sometimes it can be also related to deformities that are there, which are very minor deformities at an early age group, which nobody can actually notice it, but that leads to abnormal loading on the joint, and that can lead to these arthritic changes.
Okay.
Yeah.
And Doctor, osteoporosis is one more term when it comes with osteoarthritis. So osteoporosis, can you please explain us on that?
Yeah. So osteoporosis, when you know the term, all the people around are very much familiar with it. It is a porous bone or a weak bone, or we call it as brittle bone.
Brittle bone, correct.
So, yeah. So bone is always a living tissue. It is constantly being broken down and it is replaced by a new bone.
Correct.
So whenever there is an imbalance or the new bone that is formed is less as compared to the bone loss, there is always a chance of osteoporosis.
Okay.
So, and this osteoporosis is weakening of bone. So weakening of bone can lead to fractures because of any minor trauma or minor fall, or just a triple can also lead to fractures. So most common areas where the fractures can happen are around the hip joint, in the wrist,
elbow,
or in the spine, or also in the elbow.
Okay. Usually, many patients are elders, right? And above the age of 50 or 60.
Yeah. It is more so seen in above the 50s and 60s. Post-menopausal females are at a higher risk to develop this. Any patients who are at having a family history of osteoporosis, they have a major chance of having this problem as well in an older age. Yeah. There are various other factors also, like hormonal factors, where there is post-menopausal, the estrogen levels goes down. Also in the males at a later age, testosterone levels goes down, leads to accelerated bone loss.
Okay.
Yeah.
And some females even have thyroid, right? So
hypothyroidism. So hyperthyroidism or excessive thyroid hormone can lead to excessive bone loss. Overactivity of thyroid, overactivity of parathyroid and adrenal osteoporosis. There are various dietary factors as well to this. So decreased intake of calcium can also lead to this. Then related to gastrointestinal surgeries, if patients recently nowadays go on with bariatric surgeries, they can land up with such kind of problems. There is no absorption of calcium. Then long-term use of steroids in various conditions. These also can lead to osteoporosis.
And in general, I think obesity being a major factor. I mean,
obesity is being a major factor. Sedentary lifestyle is another factor.
Correct.
Yeah.
I actually think that there are many people who just take obesity very casually. when they think, I mean, this whole chalta hai attitude, when they don't even think about, okay, I'm getting overweight and now I should do something about it. So what would be your message to people who think it is okay?
This would be a major issue in their life later on, maybe. Now, if they feel that it is quite okay, but that leads to many medical problems as well as you know, diabetes, hypertension, these are all related to weight. Again, osteoporosis is a major thing. Your joints are under severe load when your weight is a lot. So your knee joint arthritis is most common in old age when you are excessive with your weight. So exercise and reduction of weight, having proper nutrition is very much important to reduce all these problems.
Great. And I think later on, in the later stages, living a miserable life with pain every day and being dependent on others in the family every day, it's better to be independent and be empowered. Okay.
And at an older age, if you are overweight and you're suffering from all these problems, it is very difficult at that stage to reduce your weight.
Yes.
So one should be very much aware because of our now recent trend is in an IT population. Most of the people are having sedentary lifestyle. So they should very much be active related to their exercise pattern as well as the nutrition, so that they don't suffer this problem in later life.
Correct. And I think even changing habits becomes more and more difficult as age increases. I mean, it took me 2.5 years to convince my grandfather to finally give up sugar. So he recently gave up sugar and he's not eating sugar. But behind the scenes story is that it took me 2.5 years. Whereas someone who is younger, it does not take that much time to change habits. So it's better if people start early.
And the way we are used to in your younger generation, later life would be easier and they get used to later on as well as they can avoid these factors in the diet later.
Definitely. Doctor, any advice from you for prevention of this apart from good nutrition and lifestyle changes? Any supplements or anything that they should include in their?
So, for prevention of osteoporosis, we can start with calcium as advised by the doctor, because excessive calcium can also lead to many problems like kidney stones. So, calcium, D3 and B12 are the major things which are going to hold your musculoskeletal system. So, they should be monitored regularly, and we can take proper supplements as advised by the doctors or nutritionists as per your levels up and down. So, these are the major pillars that would be holding your musculoskeletal system. So those should always be maintained properly, or else you may suffer with multiple body aches, muscle pain, muscle cramps. These things should be a common problem when there is an imbalance in this.
Also nowadays, do you see that many people have vitamin D deficiency? Is this?
Yeah. So almost in my OPD, whatever tests I have done, almost 60 to 70% people are vitamin D3 deficient.
That's a big number.
That is a lot. Maybe, and that is more so in the younger generation. Older patients, I have seen that they are very much within the normal limits, but not all. Few are there within the normal limits, but younger population, almost 60 to 70% people are D3 deficient. So that may be related to your lifestyle, because nobody is going out in your early morning sunlight.
And they are sitting on their desks all day. So what would be your advice for them, because they go into a lot of neck and back issues?
So this is for all the IT people who are working from home. So they are sitting. The most common problem they are doing at the home is that they are sitting on an improper chair, or maybe they are sitting on bed. So there is no maintenance of your proper posture. So and they are working for long hours at a stretch. And there is no exercise at all. So these are the major problems that they are facing, which they are not aware, and they are that is only leading to these neck issues and back issues. So my advice for them would be they should use a proper chair with a proper dorsolumbar support, so
Okay.
that all the muscles and their spine curvatures are properly supported.
Yes.
There is no excessive pressure on the muscles, paraspinal muscles, so there is less chance of this back issues. Again, 1 to 2 hourly, maybe they go out, take a gap, and proper stretching should be done to the muscles that are involved,
Great.
dorsolateral region, upper cervical region.
Mhm.
Uh, then maintenance of proper hydration as well as electrolytes. So
Yes.
this is the most important factor which uh, everybody doesn't follow, is
Yeah.
that your muscles require proper hydration as well as electrolytes, or else they would give away and give cramps and sudden spasms.
Correct.
So proper hydration should be maintained with proper electrolytes. We can have normal Nimbu Sharbat as well as at home that can give proper electrolytes like sodium, potassium and chloride.
Correct.
And yeah,
Okay. Great.
maybe strengthening exercises every day morning. That is the best thing that can be done. Cervical and lumbar strengthening exercises so that the muscles become strengthened and the core strength develops.
Okay. Okay. Great.
Yeah, yeah.
And doctor, many people also have this shooting pain in the hip or their legs, or
Yeah,
maybe
yeah.
sciatica pain.
Yeah. So, if such kind of problems are there in a younger patients, if they're having this pain in the buttocks or pain in the leg that is going up till the toes, there is tingling sensation in the legs, we should not avoid such, neglect such kind of things, and we should maybe immediately consult an orthopedician, because these can be related to any intervertebral disc prolapse or any spasm, acute spasm that is leading to compression in the nerve.
Okay.
So this should not be neglected.
Okay. Okay. Thank you so much, doctor. Actually, whenever I visit a doctor, the
Yeah.
the main differentiator between a good doctor and a, I think not so good doctor is when the doctor actually passionately explains everything so much in detail. And I've
Yeah.
had
Yeah.
that experience always from you where whenever a patient comes to you, you sit down, you draw, and you explain them things step by step. That is just
Yeah.
great. And thank you so much for giving us such valuable information on this topic.
Yeah. Yeah.
Yes.
Thank you, Omkar. Thank you.
Yes. So if anyone wants to get in touch with doctor, what I'll be doing is I'll be linking his details below in this video. So please
Yeah.
feel free to connect with Dr. Swaroop because he's also doing consultations over video call for some cases.
Yeah.
So feel free
Yeah.
to do that. And thank you so much, doctor, again for this
Yeah.
valuable information.
Omkar, I would like to add on something in this.
Yes.
There are a few positive points in this lockdown right now.
Okay.
So now what has happened is that this lockdown has helped us evaluate maybe the hospitals and clinic rush has decreased randomly. All the medical problems have gone away. There are some factors that I've felt that can be the reason to it. Maybe
Okay.
everybody is maintaining proper hygiene, using mask, sanitizers. So that
Yes.
is one problem. That is one thing that has led to this. Everybody is having proper sleep. There
Yes.
is decreased stress levels.
Yes.
Uh, Outside food is completely not available. So
Yes.
junk food is not there. So home cooked food is the thing that is very much nutritious, and uh,
Correct.
and even less pollution. No
Yes.
vehicles, industries are closed.
Yes.
So this is a good thing we should realize, and maybe even after the lockdown is finished, we should maintain such things so that everybody is healthy, and maybe that can be helpful for future.
Okay, that's great. That's a very nice
Yeah.
outlook to the current situation, doctor. Great.
Yeah. Yeah.